Hi, and welcome back to another STEM Seekers episode. My name is Sam.
And I'm Josh.
And basically what we want to do with this podcast is expose high school students to all the different professions in STEM and the career opportunities. So today we have a very special guest. We have my aunt, Auntie Aldia.
Hello, my name's Aldia.
And she's a practicing dentist, and we'll be interviewing her on how to be what a dentist is really like and just what comes with it.
Yeah.
So Aldia, do you want an introduction or how old you are or whatever?
Sure. So my name's Aldia. I'm 27 this year. Despite my age, I am indeed Sam's aunt. We come from a very big family, and his parents and myself were cousins. So I'm practicing in Melbourne, currently doing my paediatric dentistry training. So this is a further 3 years of specialty training compared to when we finished dental school, which you would qualify as a general dentist. I've done 3 years of work, including private practices, dental hospital-based jobs. I had an appointment at the Children's Hospital as well, and I'm also doing a little bit of research at the Murdoch Children's Research Institute.
I heard you came from overseas and into Australia for your dentistry education. Do you want to expand on that? Or
So I grew up in Malaysia, and I finished it's the year 10, year 11 equivalent, I'm not sure, SPM in Malaysia. And then what I did was that I came to Melbourne, and I did my Monash University foundation year, which is a year 12 equivalent. And then with my results, I applied to dentistry in Adelaide, which I finished 5 years of my undergrad degree in.
The dentistry is an undergraduate course that you can apply to in Adelaide.
So in Adelaide, it's an undergrad degree and it's 5 years. In Victoria, so if not mistaken, there's 2 dental schools at the moment. One in Melbourne Uni, and that's a postgraduate degree. So that's a 3-year of undergrad and then 4-year dental degree. And then I think there's one in La Trobe Uni as well. La Trobe's 5 years undergrad. Yeah, so it really depends on which university you're applying to.
Okay.
That sounds good.
Do you have anything?
Any other questions?
I mean, is there any exam that you have to take to get into undergrad dentistry? I mean, with Monash Med, you take the UCAT to get in. Is there an equivalent, or do you also take the UCAT?
So when I came as an international student, I took the PQA exam. So with most universities that you apply to, especially for medicine and dentistry, there's usually 3 hurdles that you have to get through to get into the program. First one's always an IQ test. So that would be an IQ or a aptitude test. So that would be your UCAT, UCAT, your GAMSAT, your PQA. It depends on which university and at which stage you're applying for. So for example, if you're applying to an undergrad, you might not have to take the GAMSAT, things like that. So that's the first hurdle. Second hurdle would usually be your interviews. So if you pass that aptitude test or your qualification test, you get called in for an interview. And then once you pass your interview, that's when they start looking at your results.
So it's quite similar to the process that you go through for Monash Med as well. I mean, that most students are more knowledgeable about. Okay.
Yeah. So wait, how does medical school and dentistry kind of differ? I'm kind of confused about that.
I think it differs. Dental school is very hands-on compared to medicine. I've had a lot of so when I was in Adelaide, the health and medical sciences building was basically filled with all medical and dental students all the time. So I have many close medical friends. We start hands-on work in first year. We start clinical work in pretty much end of second year, and we start seeing patients straight away. Whereas for medical students, to my understanding or to my observation, is that there's a lot of simulations at the start. It's more, I would say, probably more theory based at first, and then you really get into the practical part of things towards the end of your program or even after you graduate. Whereas for dentistry, you start clinicals from the get-go, and then by the end of your 5 years or by the end of your degree, you're expected to know everything.
Wow. Okay.
Yeah.
And it's like when you say these practical activities, like what are they? Are they like what? Putting in braces, doing like fixing wisdom teeth.
So in first year, the first thing that you look at is teeth anatomy. So you actually draw, if you look into the mirror, most people would think that your teeth are just the only description that they would say about your teeth are that it's white.
Yeah.
But if you zoom into it and you look at each different tooth, every anatomy is different. And as a first year or as a first year dental student, you're expected to be able to tell a tooth and where it's supposed to be just by looking at a tooth like that, not in a mouth. So tooth anatomy, oral anatomy as well. I think it's a very it's not a place that's really explored day to day.
Yeah.
So it's just making sure that you're comfortable. It's such a sensitive area of a human body that's not explored at all. Looking at it from a dentist's perspective is entirely different. So if first year, I would say is all about getting used to that. And then when you start in second year, we do have a little bit of sim clinic as well. It's a simulation clinic, but those clinics, basically we start doing fillings. We start to teach you how to clean teeth. We start to teach you what's normal and what's abnormal, things like that. Yeah.
Okay. And I know like there's undergraduate oral health. So I have a friend who's currently enrolled in Melbourne who's doing her undergraduate in oral health. Is that like a common pathway into dentistry later on?
I would say so. So I do have, in fact, a lot of my friends have an oral health. I think it's hygiene therapy, OHT.
Yeah, might be.
So there's quite a few dental allied health. I would say specialty, but yeah, before you do your dental degree. So I think, to my knowledge, there's oral hygienist. There's an oral hygienist. So an oral hygienist typically just does a lot of cleans. A dental therapist is another one as well, who does mainly fillings on primary teeth, on baby teeth. And then you have an oral health therapist, so an OHT, that does a combination of both, so hygiene and fillings. The job scope largely coincides with dentistry, so I guess it is a very popular degree to take as a stepping stone into dentistry. But with dentistry comes more complex work. So beyond just fillings and cleans, we're working with the nerve, root canal treatments, we're doing extractions, we're doing braces, we're doing crowns and bridges, things like that, whereas an OHT might not be necessarily trained to do so.
Okay, that's something I didn't know, because I always thought like, I'm going to go to the dentist to get my teeth cleaned, but you might not necessarily be seeing a dentist. You might be seeing someone just from in oral health.
Wow.
Yeah.
Okay. I mean, I didn't know that.
I definitely did not know that.
Everyone thinks that. Sorry, you go.
No, you go. You can go.
Oh no, I was just saying, like, everyone thinks that, to be honest, in your day-to-day or in your routine checkup and cleans, an OHT is probably who you would see in practices that do hire OHTs. But I mean, dentists can do that too. It's just up to it's just a level of training that you're exposed to.
Right. Okay.
Yeah.
Leaning on to specialties, I heard you're like a hospital dentist. Is that? I heard it from Sam. It's like different from hospital dentist and a dental clinic. It's like, is it different in like what you actually do as a dentist, or?
Yeah. So in terms of I don't want to say in terms of levels, but in terms of area of training, so you would start off as like not start off, sorry, there's a part where it's dental hygienist and OHT, where they're not necessarily recognized as dentists or doctors. And then you have dentistry, where you are recognized as doctors. So once you finish your 5-year degree for me, or if you graduated from Melbourne, it would be a 7-year degree, you would be known as a doctor or whatever. You can choose to stop there, or you can choose to specialize further in dentistry. So in terms of the different specialties that you have in dentistry, there's orthodontics, where someone would, which is probably one of the most popular ones, where they specialize in braces. There's a specialty called endodontist, where they specialize in doing root canal treatments. We have prosthodontics, where you specialize in doing crowns and bridges and dentures. Oral surgery, where you do surgical procedures. And personally for me, there's also special needs dentistry. And personally for me, I'm doing pediatric dentistry. So pediatric dentistry, compared to all the other specialties, is very much hospital-based. Reason being, the nature of the specialty is that we see lots of developmental and growth dentistry, if that makes sense. So kids stemming from a few days old to when they are 18. So you can imagine, like, you guys, how old are you? You guys at the moment?
Around 16,
16?
yeah.
You're changing a lot. You probably just lost, your last two probably just came in 4 years ago. So there's a lot of there's a lot of growing involved, and there's a lot of things that can go wrong, especially with kids that are medically compromised as well.
Yeah.
So we look after that cohort of kids, and because of that, our job is mainly, I guess, hospital-based, and we do lots of GA work as well, so general anesthetic work. We do lots of conscious sedation, where we use nitrous gas which I'm sure as well some of you guys might have, to calm the patients down. So a lot of behavioral management involved as well.
So you said health complications. What do you mean by that?
Yeah, so in a pediatric population, a lot of them you don't see out in the world because, one, they either have a short lifespan, or two, they're just not fit and healthy enough to get out into the population. So when I say medically compromised, I'm talking about kids with cancer. I'm talking about kids with leukemia. I'm talking about kids with syndromes. I'm talking about kids with cerebral palsy, for example. So a lot of them are in and out of the hospital a lot. And with pediatric dentistry, we look after, majority of the cohort that we look after are kids that are medically compromised.
Right. And is there, like, these medically compromised patients, do their medical complications have a direct impact on their oral health? Or is it just another thing?
They do have quite a direct impact, I would say. So just for an example, kids with a hemophilia disease, so they have problems with their clotting mechanism, so they are bleeding a lot. If you have gum issues, that's going to be an issue because that's going to keep bleeding, for example. To, for example, a child with cerebral palsy, where their motor functions might not be as good, so brushing is not an option for them. And you could imagine what's happening in the mouth with all the decay and all the risk of infection. And obviously, treating these kids are not easy because they probably won't be able to tolerate treatment in the chair. So that's why we have access to general anesthesia, so that we can treat them when they're asleep. Little things like that. And part of my day-to-day job in a hospital as well is treating trauma. So kids ranging from a few months old, just starting to walk, and then they knock their faces into a coffee table, for example. That's pretty cute, but it happens every single day. To maybe a 16-year-old who got hit by a bus when on their electric scooter. Things like that. So we do see quite a range of trauma as well at the hospital.
And is that the most common type of, like, your treatment that you're seeing?
Trauma, are you talking about?
Yeah, trauma.
Yeah, I would say so. Like baseball bats, playground accident. And it's always teenagers who come in 2 weeks after they've had their braces taken off. It's just unlucky, I guess. But yeah, it does happen.
That's pretty unlucky.
Did you know that you want to, like, do this kind of dentistry and become this kind of doctor, or?
I grew up in a family of dentists. My dad was an orthodontist. 2 of my older brothers are orthodontists as well. So for me, really, dentistry was always in my mind. It was a question of whether I wanted to specialize. And if I did want to specialize, what would that be? I did think about orthodontics as well. I guess, with the family influence that I had. But I think
Yeah.
ultimately, having been in the workforce myself for a little while, I think I sort of, like, in terms of my personality and my interests, sort of gravitated towards pediatrics a little bit more. And apart from all those things that I've mentioned earlier on, there is a day-to-day dentistry that I do as well. So like I do a little bit of interceptive orthodontics as well. So like kids who are 8, 9, who haven't had their full set of teeth come through and have some crowding issues or whatnot, where we have to jump in to intercept their growth. That's part of pediatric dentistry as well. So even though it's pediatrics, it's still a variety. It's really different from the rest of the other specialties, where, for example, an endodontist would just do root canal treatments on the teeth. But for pediatrics, it's like, I'm pediatrics, but I do everything as well still. There's still some variation. And I think that to me was really interesting.
So do you have a lot of the dentists going into specialties after they finish dental school, or is that like a very select few?
It's quite competitive. It depends on, so for pediatrics, at least for my, I'm currently in training at the moment. So they accept only 3 a year in the whole of Victoria.
Wow.
It's only Melbourne University that in Victoria, it's only Melbourne University that offers specialty training. So they accept about 2 to 4, I would say, a year typically. And then for pediatric dentistry in particular, they also have the program in Sydney and Perth, if not mistaken. So the whole Australia, there's 3 universities accepting postgraduate dentists, and typically it's about 3, I would say. It's probably similar to the other specialties as well.
Yeah, but it's not something that you have to go through, like do immediately after you finish dental school. You can work a bit and then you can realize that you want to specialize.
Yes. So the minimum requirement for you to apply for any specialty training is 2 years of working experience. And then see how you go. Some people don't realize that they want to specialize until they're well into their years, which is fine. But yeah, it just takes the momentum changes as you go in the workforce, and it takes a lot to get back into studying again.
Yeah. So I mean, it's quite different from what you would see like a doctor would do, where they're kind of exposed to all these different specialties in the final year of medical school, and then you're pushed to, get placement in a specific specialty program.
Yeah. Well, you are, so as a general dentist, you can still do all of the above that I've mentioned. Yeah, you can still do braces, you can still do root canal treatments, you can do crowns and bridges. Specialty training comes in when you do more complex stuff. Yeah, so I would say that in your final year of dentistry, you typically would be exposed to every specialty, but you might not be exposed to the complexity of each specialty.
Okay.
Dentistry seems kind of very complex.
Do you ever feel like it gets boring sometimes? Because I don't know, there's not a lot of, how would I say it? I guess when I was considering dentistry, what I was told is that you're in such a small area that there's only so many different procedures that you can do. And then sometimes over a long period of time, that can kind of get boring.
Yeah, I've heard that as well. And to be honest, with everything, once it becomes bread and butter, once you master everything, it will get boring. And that's actually why I chose pediatrics as well, because I'm not just it.
Because you've got that social element that's engaging.
Yes, the social element that's engaging. And I'm changing my environment very often as well. One day I'm in the ED, one day I'm in the clinic, one day I'm upstairs in the ward, one day I'm in theatres. So for me, the specialty worked well. But I also know some people who thoroughly enjoy just clinical dentistry. For me, I don't think that's for me. I get restless after being in the same place for about 2 to 3 hours. So yeah, I guess it works differently for everyone.
Yeah. And I think you can also explore a lot in like academia. As you said, you're doing research, right?
Yep. So I'm doing a little research at the MCRI, so Murdoch Children's Research Institute. Without getting to the details of what the research is about, essentially we are looking at the there's a few projects that's being run at the moment. Which one is interesting for me to talk about? Let's see. Okay, the one. What was it? Sorry.
Any of them will do.
Yeah. So the major one that I'm working on is studying health interventions. So there was an app that was developed for early childhood, how would I say, upbringing. So it's not just dental. It's about nutritional habits. It's about their screen time. It's about education for parents, breastfeeding habits, things like snacking habits and things like that. So there's an app that was developed for parents to tap on as a resource. And then we're studying the effects of the app or the intervention on their dental health, for example. So there's that. This one's mainly nutrition. There's another study that's studying the effects of vitamin, like daily doses, like daily vitamin D supplements, and their effects at 3 years, 4 years, 6 years, and their dental health, things like that. So it's quite interesting.
So I mean, this research leans more towards like the social aspect of the social influences that impacts oral health, right? Because I think from what I've been exposed to, say orthopedic surgery, which I see at home, is that it's a lot more about like the practices and the specific anatomy.
It depends on. There's a little bit of clinical aspect to the research part of things as well. It just depends on the project that you're on. There's another project that might be more interesting to talk about. We are actually looking to develop a caries detection tool where you, for example, it's like a COVID test. So if you swipe it in your mouth, you might know, or maybe this X amount of bacteria increases. Then you know that, this person might have decay, things like that. It's mainly to help children who are in the remote areas where they don't have access to dental care. So that if they have, for example, maternal child health nurses, if they could just do a little swab, and calculate their risk maybe. So that's in the process of being developed at the moment. We'll see how that goes.
Seems like a lot of work.
Yeah.
Yeah, I'm fairly new to research, I would say. I wouldn't say that I'm totally engrossed and totally sold in for research, but it's good to see. I mean, it's a good experience to have just to see what goes on in that part of the world, I guess.
Yeah, but I mean, dental academia is not that common, is it? Is it?
I don't know. There, in terms of clinical teaching, I would say it's quite common. A lot of people do it. Even Oscar does it. So Oscar's my husband, and he's a general dentist as well. Yeah. So he does clinical teaching in University of Melbourne. But in terms of lecturing, then maybe that's not too common. But having said that, quite a few people still get into it.
Yeah. Okay. So do you mind running us through what a typical week in your life is, sort of so people can get a grasp as to what are the social demands of being a dentist?
Yeah. I'll talk about being a general dentist first, and then I'll talk about being a pediatric dentist afterwards. Maybe that would be a little bit helpful. So when I was a general dentist, I worked about 5.5 days a week. And it's I dabbled in a bit of private and a bit of public work as well. So in private dentistry, my typical day, my first patient comes in at 9, so I get there around 8:45, set up. I get through about 13, 14 patients a day, with an hour's break in between for lunch, and then my day ends at 6. Well, it also depends on the procedure that you do, but a typical average day, chill day would be, I guess, 14, 15 patients a day. And I love that I end my job at 6. Yeah. On busy seasons, it can go up to about 20 patients a day. That's back to back to back. And it can get quite exhausting, I would say, because dentistry is very isolating. When you're in a room and it's just you, your dental assistant, and the patient, you're really the only person who knows what's up. So it can get quite stressful. and my experience with general dentistry, again, with my personality as well, I do get quite restless after being in the room for about 2 to 3 hours straight. And it's hard to focus and do good work.
Right.
So do you have
It's
any
my experience with it.
tips?
Do you have any tip for combating that, like the stress, the pressures, or like just like exhaustiveness of it?
So if I were to do things all over again, I would definitely have one weekday off. Whether that weekday is for me to rest and catch up with my household chores or to not do anything, or again, with dentistry being a little bit isolating as well, if I could use that one day of work to observe any other clinicians that are working, I could be studying for another exam, I could be reading up on papers. That would have been a bit more useful for me, I think, instead of just having to jump straight into clinical work like all the way through, because then you don't get time to upskill. In medicine, you're always working with someone when you're in your early years. You're reporting to your consultant, and that's when you know that, oh, this is what I have to do better. You're learning as you go. Whereas in dentistry, you're really out on your own, and if you don't intentionally put in time to do that, then you probably will never upskill.
Right. Okay.
Yeah.
I think the meeting is running out of time.
Yeah.
But I think just to finish up, would you have any tips to high schoolers advising them about dentistry?
Take your time to think about it. Dentistry is a very niche area. If you once you get into it and you're not sure about it, it's very hard to get out of it. And it is a degree that unfortunately costs a lot as well financially. So make sure that you're really, really up for it before you sign up for a lifelong commitment to dentistry. It's a tough job, I would say, but if you're able to find a balance, it's fulfilling.
Yeah.
Rewarding.
Awesome. Well, thank you so much for being our second guest and coming to speak about dentistry. And thank you again for listening. Those who are out there.
Yeah, exactly.
Yeah, cool.
Thanks for having me.